Hi everyone, good morning. How you all doing today? I hope you had a good night rest. So, welcome. My name is Dr. Adora, and I'll be giving you some health tips today. And I hope you would get some things from what I'm about to tell you. So, our topic today will be cardiovascular diseases. Cardiovascular diseases are one of the leading causes of death globally in the world today. We have diseases such as rheumatic heart disease, infective endocarditis, coronary artery disease ranging from anginas. They are non-communicable diseases that affect our heart and blood vessels. Now, how do we get this cardiovascular disease? We have some risk factors, that is, some things that predispose us to having this disease, such as people that take tobacco use, cigarettes, and all forms of smoking, both passive and active. What I mean by passive is you're constantly exposed to people that are smoking. So without an active use of the cigarette, you actually have contact with the smoke. You inhale the smoke that is around you. Another form is an active smoking, which is actually you're the one smoking the cigarette direct. That's direct contact. Smoking, alcohol use, family history of cardiovascular disease. There are risk factors for cardiovascular disease. Also, someone who's hypertensive and diabetic. And also a sedentary lifestyle. What I mean by that is people that are very inactive. They don't do any form of exercise. They just like to sit one place and not get engaged in any form of activity. So these are the risk factors for cardiovascular disease. Other things that can predispose you to this is a family history, like I said before, and some symptoms that we can get or that we see when you have a cardiovascular disease. You can have a chest pain, which is excruciating, that it's chest tightening, that is like it feels like someone is squeezing the life out of you. Other things are a pain on your shoulders. Sometimes it can also be asymptomatic, that is, you don't have any symptoms, you just come down with complications. Other times your blood pressure will be high. When somebody is having imminent heart failure, the person becomes to get breathless, because the heart is what pumps blood to the lungs, and then we get oxygen from the lungs. So if you're not getting enough blood supplied to the lungs and not enough oxygen in your blood, you become breathless. So you have things like you're breathless, you're tired all the time, and when you walk just a little distance, you feel exhausted. Those are some of the symptoms you can get when you're having a heart failure or about to have a heart failure. But not all the time do we get this. So it's important that we go to the doctor to get ourselves checked whenever we feel that we're not very healthy. We also have complications that arise from cardiovascular disease, such as heart attack, stroke. Stroke is one of the leading causes of deaths, of sudden deaths in our time and in the world today. So I'm not trying to scare anyone, I'm just trying to let us know that there are a lot of things that we have to consider when we try to maintain good health. So those things that we have to do to be healthy, to prevent all these diseases that affect the heart, is that we should be on a healthy diet, reduce our salt intake, try to exercise, try to avoid smoking and alcohol use, because those are the things that predispose to cardiovascular diseases. So these are just a few of the things that I have for you today, and let me know if you got some information from this, and if you have have any family history, like a mother, a father, a sibling that had and maybe has cardiovascular disease, that has hypertension, that has diabetes, it's important. I'm reiterating that it's important that we go to the hospital to make sure that we do not have this hypertension, because it's important that we treat it as early as possible. It's not something that goes away, it's something that's just there to stay. So it's important that we start managing it on time to prevent the complications that I've earlier stated, like stroke and a heart attack. So I just want to wish us all the best. Have a good day, and try to visit your doctor. It's really important. I love you guys, and see you next time.